Hello, my name is Mr. Sankar Ananth. I'm a consultant maxillofacial surgeon based in South Wales in the United Kingdom. I've been a practicing maxillofacial consultant for the last 12 years. I also have the role of the training program director for maxillofacial surgery for Wales. So I've been using PIEZOSURGERY for about 10-11 years now, soon after I started my clinical practice. When I finishing my training, I had the opportunity to get a first-hand sort of training at a conference, actually here in Italy at the time. And when I took on my role, I then requested that I could trial the use of piezo. And surprisingly, it didn't take very long to get to know the machine and get to use the instruments and to sort of master the technique of using the PIEZOSURGERY. So it was relatively easy, and of course I had very good support from the Mectron team at the time to help set up and also learn and to use the machine. They attended a few times with me in surgeries to allow me to make sure that it all goes well. So it was really good, and I haven't looked back since. So when I was a trainee, we used to use conventional instruments to do the bone surgery, mainly osteotomies and trauma. And there's always a challenge of avoiding risks to the nerve mainly, and the extent of bone damage in terms of necrosis and inflammation. With piezo, what I found was really very reliable in those terms that you minimize bone inflammation, your soft tissue was well protected and safe, and you could very reliably give it to the trainees to do it, knowing that you will not damage any of the important neurovascular structures. Second thing is it's very precise and very tactile, so you're in control, you can reproduce the procedure without any problems, and you can perform more complex procedures because it's so precise in its cuts. When you plan them beforehand, you are rest assured that it is really does what you want it to do on the day. My remit of practice is largely orthognathic surgery, which includes maxillary osteotomies, mandibular osteotomies, genioplasties, bone grafts from calvarium and hip and rib, and also I use it for my craniofacial trauma, mainly around the orbit region for osteotomizing the orbit and zygomas. I also like to use it when there are more complex dentoalveolar procedures where you have a large cyst which needs delicate removal and we need precise bone cutting to enucleate the cyst. So these are my common areas of practice. I know there's a wide range of uses with these, but in my day-to-day practice, it's these areas I tend to use most often.